This is my physical assessment video. My equipment is my stethoscope, my watch, a cotton ball, gloves, and a pen light needed for this skill. My plan is to obtain a full physical assessment from my patient, obtain any prominent medical history, any past surgeries, any allergies, and any family medical history. With that, I'm going to begin my skill. Knock, knock, knock. Good morning, Mr. Harris. My name is Hayla. I'm going to be your student nurse today, and I'm going to be obtaining a full physical assessment on you. Is that okay?
Yes.
Okay, so I'm going to wash my hands. I'm going to provide privacy. Can you tell me your name and date of birth?
Spencer Harris, 010901.
Okay, and we've already assessed your blood pressure, your respirations, your oxygen, your temperature, and your heart rates. So can you tell me a little bit about why you're here today?
I have pain in my right shoulder.
Okay, and when did that start?
2 days ago.
2 days ago?
Yeah.
And you said your right shoulder.
Yeah.
Is it like a pain that comes and goes?
Yeah.
Okay, it comes and goes. Can you tell me your pain on a scale of 1 to 10?
A 6.
A 6, okay. And does it get worse? Does it get better with anything that you try?
Tylenol.
Just Tylenol? Okay.
Yes.
Gotcha. And can you tell me where you're at?
I'm at the hospital.
Okay. And then can you tell me what time of day it is?
It's midnight.
Okay. And then can you tell me your name?
Spencer Harris.
Okay. And tell me why you're here.
For pain in my right shoulder.
For pain in your right shoulder.
Yes.
Okay. Gotcha. So after that, I'll be assessing skin throughout this entire physical assessment. So we're gonna start with your scalp. Let me take a look at it here. I've already put on my gloves. Let's see. Do you have any pain when I touch your head?
No.
No? Okay. Have you had any surgeries on your head?
No.
No? Okay, so it looks good. Okay, I'm gonna have you sit your head up for me. So Mr. Harris, I want you to close your eyes for me. And then we're gonna be testing your 5th cranial nerve. So whenever I touch you on your face, I want you to tell me where I'm touching you, okay?
Okay. My forehead.
Okay.
Chin. Right cheek. Left cheek. Nose.
Okay, great. Your 5th cranial nerve is intact. So next we're going to test your 7th cranial nerve. I want you to smile really big for me. Great. Now I want you to frown. Puff out your cheeks. Okay, now raise your eyebrows for me and lower them. Okay, good. So your 7th cranial nerve is intact. So the next thing we're going to do is your eyes. For the cranial nerve 2, I would assess visual acuity with the Snellen chart. So since we've already assessed your 2nd cranial nerve, you have 20/20 vision, perfect. And the next thing we're going to do is we're going to assess your 3rd cranial nerve. So I have my pen light here. It's kind of an annoying light, but I need to take a look at your pupil dilation. Is it okay?
Yes.
Okay, so just go ahead and look directly in this light for me. Good. Good. Okay, so your pupils are equal, round, and reactive to light with accommodation. So great. Cranial nerve 3 is intact. So now we're going to test cranial nerve 6 and 4. I need you to look right here at this pen light. I want you to follow it with your eyes, okay?
Okay.
Okay, great. So cranial nerve 6 and 4 are intact. Let's see. Next thing we're going to do is we're going to do your ears. And I'm just going to take a look in your ears. Do you have any pain when I touch your ears?
No.
No? Okay. Do you wear any kind of like hearing aids?
No.
No? Okay. So we're going to be testing your 8th cranial nerve. So I'm going to cover one of your ears and I want you to tell me what I say, okay?
Ginger ale.
Okay.
Apples.
Okay, great. your eighth cranial nerve is intact. So now that we've done your ears, let's take a look at your nose. I'm just gonna take a look up in your nostrils. Don't see any drainage or sign of septum deviation. Have you ever broken your nose?
No.
No. Do you get frequent nosebleeds?
No.
Okay, so I'm just gonna palpate your sinuses. Does it hurt when I touch you here?
No.
Okay. So I'm just gonna include one of these nostrils. I want you to take a deep breath in. Do you have trouble breathing when I do that?
No.
Okay. And at this point in my assessment, I would assess cranial nerve 1 olfactory by asking my client to close their eyes and identify a scent for me. Okay, so now that we've done that, I'm going to take a look inside your mouth. Can you just open your mouth for me? Do you go to the dentist regularly?
Yes.
Okay. And, let's see, do you have any trouble swallowing?
No.
No? Okay. So here's what I'm doing. I'm gonna have you open your mouth and say ah, and then I want you to swallow for me. Okay. Okay, so your palate moves up. So your ninth cranial nerve is intact. At this point in the assessment, I would assess cranial nerve 10, the vagus nerve, by having a tongue blade, and then testing my client's gag reflex, but I'm not going to do that for the sake of this video. Okay, so we have one more cranial nerve we need to assess, cranial nerve 12. I would like you to open your mouth and stick out your tongue for me. Okay, move it up and down, and move it side to side. Okay, do you have any trouble moving your tongue when you do that?
No.
Okay, good. Okay, so the next thing we're going to do is we're going to assess cranial nerve 11, the accessory nerve. So I'm going to push down right here. I want you to shrug your shoulders for me. Okay, good. Now I want you to move your head side to side. Okay, good. I'm just going to palpate your neck here. Do you have any pain when I touch your neck?
No.
Okay, do you have any history of like hypo or hyperthyroidism?
I don't.
No. Okay, I'm just going to feel for your carotid artery. Okay. Okay, equal strength on both sides. Now I'm just going to put my hands up here. Can you open and close your mouth? Okay, I don't feel any clicking when you do that. Okay, so now that we've done that, we've done neck, see? Okay, Mr. Harris, I am going to listen to your lungs. Normally I would listen on bare skin, but for the sake of the video, I'm not going to undress my client. So I'm just going to take a listen to your lungs here.
Okay.
Okay. Mr. Harris, do you mind sitting up for me so I can listen to your lungs on your back?
Yeah.
Thank you. Okay, you can go ahead and lay back for me. Your lungs sound clear. So the next thing I'm going to do is I'm going to listen to your heart. I just need to hit a couple of the different areas where you would listen.
Okay.
Okay, so I'm going to listen right here at your apical, tricuspid. Oh no, this is your pulmonic, tricuspid, Herbs point, and your mitral. So I'm just going to listen for a full minute at your mitral. Okay, perfect. So now that we've done your heart, and assist you to a comfortable position. I'm just going to take a look at your abdomen. I'm not going to pull up my client's shirt for the sake of this video, but I would assess the abdomen for any skin lesions, any scars, any kind of sores, anything like that. So the next thing I'm going to do is I'm going to take a listen, and I would listen on bare skin in all 4 quadrants of the abdomen. Okay. Okay, I'm just going to palpate your stomach. Do you have any pain when I do that?
No.
No. When was your last bowel movement?
This morning.
This morning? Okay.
Yes.
And have you had any surgeries on your abdomen before?
No.
No? Okay. Good. And then I would assess the groin and the anus for any abnormal discharge, any sores, anything abnormal.